Welcome back, dear viewers. The Japanese Embassy in Cairo and UNICEF inked on Sunday an agreement and a memorandum of understanding, an MOU, to implement a project to expand the scope of vaccination against COVID-19 in Egypt. And to shed light on that and much more, and the coronavirus situation here in Egypt, we are honored to have with us now live over the phone Dr. Muhammad Awad Tajuddin, advisor to the President for Health Affairs. Dr. Tajuddin, a very good morning to you and thank you for joining us. Dr. Tajuddin, good morning, sir. Can you hear us? Sir, can you talk to us about the importance of the latest MOU in strengthening Egypt's plans to combat the pandemic? Right. Right. We'll get back to Dr. Tajuddin. He'll be with us now shortly. And as we told you, the Minister of Higher Education and Scientific Research and Acting Minister of Health and Population, Dr. Khaled Abdel Ghaffar, and Dr. Rania Al-Mashat, Minister of International Cooperation, had witnessed the signing of the MOU, the agreement between the Japanese Embassy in Cairo and UNICEF, worth $3.5 million to implement a project to expand the scope of vaccination against the virus COVID-19 in Egypt. We'll be discussing that topic with His Excellency Dr. Tajuddin, the advisor to the President for Health Affairs, after this short break, dear viewers, so please do not go away. All right, we've got Dr. Tajuddin back. A very good morning to you, Dr. Tajuddin. We are honored to have you with us. Dr. Tajuddin, can you hear us?
Hello?
Yes, Dr. Tajuddin, thank you for joining us.
Thank you very much for the kind invitation.
Dr. Tajuddin, can you talk to us about the importance of the MOU signed between, of course, the Japanese Embassy in Cairo and UNICEF in order to expand the scope of vaccination against COVID-19 in Egypt? This, of course, in coordination with the Ministry of Health and Ministry of International Cooperation.
Yes, it's very important, and we have a very good cooperation with the Japanese side. And already, as you know, we have a very good number of facilities to provide the vaccines for COVID. And the Egyptian vaccine coverage now is very good. And this is one of the cooperation to potentiate synergetic potentiation of the vaccine coverage in Egypt.
Right.
Already we have more than 1,500 sites for vaccination, and expansion or extension of these vaccination sites is very important to provide the vaccines for more people in Egypt.
Right. Dr. Tajuddin, can you update us on the current situation regarding the coronavirus and the Omicron in Egypt at the moment? How do you assess and evaluate the situation at the moment?
Now, as you heard from the media, we have increasing number of the people infected with coronavirus infection, but the cases, most of the cases are mild or mild to moderate cases, and you have a very good number of facilities to provide the services for the patients. Also, we have the all of the medications required for the treatment of our patients is provided for them, so that we have now, and also the capabilities of the hospitals and the intensive care units and the units for mechanical ventilation already ready for any intervention required for any patient infected with coronavirus infection.
Right. Dr. Taguddin, whilst His Excellency President Sisi was in Brussels attending the EU summit, he thanked the EU for giving support to Egypt in the technology, one of the few African countries that got that support to manufacture drugs and for vaccination against coronavirus. Your comment on that, sir?
Already started this project for manufacture of the coronavirus vaccines in Egypt, in Vaxera, and we have cooperation with the Chinese side since about 8 or 9 months, and already now we receive the raw material from China to manufacture vaccines in Egypt. But the new project is very important, and appreciation of His Excellency the President of Egypt is related to technology transfer from the basis of manufacture of vaccines to put Egypt as one of the facilities in Africa to supply Africa and any other countries with any new vaccine or already available vaccines. But as you know, still we have not only on the level of Egypt, because now in Egypt you have different types of vaccines, but the problem in Africa, the required amount of vaccines or doses of vaccine is not fulfilled up to now. So that the manufacture of vaccines in Africa and the choice of Egypt as one of the facilities is very important for us and for Africa.
Right. Dr. Taguddin, and your advisor to the President for Health Affairs, to what extent did the presidential initiative 100 million healthcare have an impact on health services to citizens, especially in remote and less privileged areas, and especially in the tough times we live in now, combating the pandemic?
This is a very important question. The one side, you discover by this initiative early detection of some of the diseases, which is very important diseases, like hypertension, diabetes, or congenital abnormalities, or any underlying disease which is not covered by the individuals. And the second point, as you know, the patient with chronic uncontrolled diseases, like cardiac diseases, artery diseases, diabetes, etc., if the patient is infected with corona, the side effects or the progression of the disease is more with the patient with underlying chronic disease. So that early detection of the diseases and the proper treatment or proper management of the underlying conditions, that it will be reflected positively on the health of population and also on management of coronavirus infection.
Right, Your Excellency, Dr. Muhammad Awad Taguddin, Advisor to the President for Health Affairs. Thank you very much for your precious time. Dear viewers, please stay with us here on The Breakfast Show. We'll be back with more shortly. Do not go away.